Hi, I'm Danielle. I'm a spine physician assistant who works with the team at Gillette. In this short video, I'm going to briefly explain some of the surgical options for those who may benefit from scoliosis surgery.
Scoliosis is a rotation and sideways curvature of the spine. It usually occurs when you hit your growth spurt during puberty. Scoliosis affects about 4 out of every 100 people between the ages of 10 and 18. You will only need to consider surgery, though, if the curvature of your spine is 45 degrees or more. To put this in context, if you take a sample of 1,000 people, 40 will have some kind of scoliosis, ranging from mild to severe. Of these 40 people, 12 may need to use a brace, and 4 may benefit from surgery. Let's take a look at 2 surgical options available to those who may benefit from surgery. For those who may benefit from surgery, the 2 options are spinal fusion and vertebral body tethering. Now, those might sound like a mouthful, but don't worry, we're here to explain them. Let's talk about spinal fusion first. The most common type is a posterior instrumented spinal fusion. Posterior, because we enter through the back. Instrumented, because we use screws and rods to hold the spine in a straighter position. Spinal, for obvious reasons. And fusion, because our goal is for the individual bones being held by the screws and rods to fuse together into one solid piece and to remain in the straightened position. Here, you can see a portion of the spine that has been fused together. You can see that the screws enter the spine from the back and are seated in the front of the spine. Many people wonder if this type of procedure will prevent them from being flexible or being able to bend over. The answer is, while you will lose some flexibility, this procedure should not prevent you from participating in most activities. Now, let's talk about vertebral body tethering. A rope or tether is connected to the outside of the curve using screws placed into the side of the bones of your spine. The tether is then tightened. This allows the inside of the curve to grow as your body is growing and catch up in height with the outside of the curve, causing a straightening of the curve. Because this procedure does not use stiff rods and no fusion of bone is happening, the flexibility of the spine is maintained. If you or someone you know has scoliosis, then this video very well may raise additional questions for you. If that's the case, please join us at the link below to see a whole world of information curated specifically by adolescents and families who have had spine surgery. From all of us at Gillette Children Specialty Healthcare, thanks for watching.